There, my lovelies. Hope you guys are doing well and staying safe. Today, I am coming to you regarding a very important public health matters, which is coronavirus. Yes, I did talk to you about COVID before and its impact, but we have come to a point now where so many people, we are breaking records, not in a good way. We are breaking records in the total number of new infections each day, number of hospitalization, number of death, and this is not good. According to John Hopkins, just yesterday, over 141,000 people got infected with coronavirus. That's a new infection, number of new infection. And then there were over 65,000 hospitalization from COVID. And just a few days ago, there were over 1,400 deaths from coronavirus. US has surpassed 10.4 million people who are infected with COVID and over close to 242,000 people who succumbed to this disease, this pandemic. Today, I come to you with an urgent message. In the past November alone, we have had over 1 million new infections. And in Texas, they have over a million infection rate. Hospitals are overwhelmed. They're really overwhelmed, and to the point that they have to send adult patients who are sick with coronavirus to pediatric hospitals to take care of them. Imagine this. You're an adult and you're sent to a children's hospital to take care of you. In South Dakota, the positivity rate is 50%. That means 50% of people who are tested are COVID positive. This is not good numbers. As an epidemiologist, I can tell you this is not good. If you thought March was bad, it was nothing compared to what we are going through right now. The health system is in a brink of collapsing if this continues. Now you may ask why I'm talking about all this. To me, it is important because I'm in public health. But according to the CDC, if you wear mask and you can, it is effective against 70% of transmission. Imagine how many people you can protect. Your loved ones, your neighbors, your community. I cannot tell you how dire the situation is. So, if you are given the chance to protect your loved ones, your family, your extended families, your community, your neighborhood, everyone in your state, wouldn't you do it? You can do that. Please wear mask. Masks, I do not live without this. I know it is hard. It has been so long since things were back to normal, but this is some things we have to do together. this is something we have to do for our country. At this time, JFK's this famous word come into my mind. Ask not what the country can do for you. Ask what you can do for your country. And I can only ask you that. Please do this for your loved ones, your friends, your extended family, your community, your surroundings, your country. Do this for them. Together, if we all wear masks, we can defeat this pandemic. Again, wear a mask. This mask that you see me, that a lot of people wear, is very effective. Of course, the most effective one is what the healthcare providers wear. And because they have to be near infectious people, and that's the N95. When I worked in a hospital, I had an N95. And these are widely available now. It's not like March or April when you couldn't find one. You know, the ones, bandanas, they don't work as well if you just tie a bandana around you. The ones that looks like it's like a long, it goes from your neck to your nose, that is not as effective. A cloth mask is better than those. If you buy a cloth mask, or you make a cloth mask. If you get a cloth mask that has layers, it says 3 layers. This one has 3 layers. If you get a cloth mask that is 3 layers, that is effective. And remember, there are those masks that has those bulb, makes it easier for you to breathe. It protects you, but it does not protect the people around you, because the air is filtered out. So you can wear this. You can wear a cloth mask. You can wear a mask that has 3 layers. Now you can even find masks that has 4 layers. The N95, they have 5 layers, and these are great. But if you wear just this or a cloth mask that has 3 layers, you are protecting yourself and a loved one. How am I going to give an analogy? Remember, just think of it this way. This is you, and this is the person standing next to you. Not only you have to wear a mask, if you social distance at least 6 feet separation, that's coming extra layer of protection for you and your loved ones. Imagine this: you and another person close to you. This person is not wearing pants. You are not wearing pants. If you pee, you're gonna mess yourself. You're gonna have pee all over yourself, and you're gonna have that on the person next to you. There's a higher chance of happening. But imagine if you are wearing pants, but the person next to you is not. Then if you pee, if you urinate, it's definitely going to go on you, and there's the likelihood that it will go on the other person. But if this person pee, definitely it will go on him. But there is also a chance it will go through the barrier of your own clothes and get to your skin. And now imagine both of you are wearing pants, and if you guys both pee, there's a less likely chance of it going hitting each other skin. And now you're separating yourself 6 feet of separation. The chances become even less. I know this is a bad analogy, but I just want to get my point across. Why do we wear seatbelt? We just don't. Not only we do it to protect ourselves, but our loved one who are next to us. If we don't wear seatbelt, I have I would say friends who lost loved one because they got ejected from the car during an accident. Let us all work together. Let us all wear masks, practice social distance. And if you go out, I'm not saying stay home constantly, but if you do go out, wear a mask, social distance, and when you come home, make sure you wash your hands. You go next to your loved ones. I have a loved one who is a vulnerable population. She, small cold, that is nothing for you and me, it will land her in a hospital. So to protect her, everyone in my household, we practice social distancing. We wear masks. We wash our hand. And we follow all the good hygiene. And I am also protecting my neighbor who just retired. I am protecting everybody who are around me. I know it is hard right now. Before 2/3 in a survey, 2/3 of Americans, people who were asked if you were recommended, if you were told to stay home at your own will, 2/3 said in March, April, they said yes, they will do it. But now it's only 40%. I know we are all tired. I am tired. You are tired. We are all tired. How it's affecting everybody. Ourselves. Follow all these steps. Just do it every time. We are going to not only protect ourselves, our loved ones, our neighbors, our communities, but as a group, we're protecting our country. Let's do it together. Let's all wear masks. Let's social distance. And let's follow good hygiene. The surges in new infection also has to do with people, extended family members who are not part of the same household, gathering together. With Thanksgiving coming, I know that is very difficult not to do or not to think of. Thanksgiving is all about family coming together, family and friends. Way of doing Thanksgiving this year is I'm sending a Zoom invite to all my families. And they're each going to cook Thanksgiving meal at their own home. And we're all gonna gather in front of the computer. We will have good times. And we're gonna have dinner, Thanksgiving dinner together. I know this is not what we imagined even a year ago that we'll be doing. But we have to do this to defeat this pandemic. My dear lovelies, I urge you all, 1,000 people, think of those 240,000 Americans who have passed away due to COVID, and the 240,000 families who lost loved ones. This Thanksgiving is not going to be the same for them. But let's make it better for the future. It is at least one thing we all owe to each other. We have to work together and take care of all work together. Let us all work together and help each other out. Let us stand in face of this pandemic. We stand up to this pandemic and tell it, enough is enough. You cannot hurt us anymore. And it ends now. I wish you guys all the best. Take care and happy viewing. Bye.